Before you decide to have a baby, it's very important to speak to your specialist diabetes team. Your blood sugars need to be as near normal as possible when you become pregnant. Why is diabetes and pregnancy such a problem?
For patients with type 1 diabetes and pregnancy, there's a problem because there is much more in the way of complications for both the mother and the baby. Having said that, these complications can be reduced to the same frequency as that of a pregnant lady who doesn't have diabetes if we can get the mum's diabetic control very tight throughout the pregnancy. Ideally in the months leading up to pregnancy, but that can mean having really very good diabetic control for almost a year's period, and that's really quite tough. In most diabetic clinics, where there's a combined clinic with an obstetrician, it means really coming every probably 2 weeks to a clinic where you might see a diabetes nurse specialist and a diabetologist. You might see a midwife and an obstetrician, and they'll be talking about various scans, getting diabetic control very tight, and that's problematical because you run the risk of hypoglycemia. We already know that hypoglycemia is quite common in the first third of pregnancy, so that's a problem. We need to let patients know about hypoglycemia, get the warning symptoms, make sure they don't overcorrect, give their partners glucagon. We need to make sure that we're looking at complications of diabetes during pregnancy. So if you have got eye disease or kidney disease, we'll be doing much more in the way of tests during your pregnancy to make sure those are stable. And we really need to be making sure that your nutrition is good, so you'll get to see a dietitian, hopefully on a couple of occasions during the pregnancy. But the important thing is getting diabetes control tight, and that will give you the best chance of ensuring a good outcome.
Was it a planned pregnancy?
Yes, it was a planned pregnancy. I had to make sure that I had good blood sugar control before I thought about becoming pregnant, so I made sure that I had that.
It was a planned pregnancy, yes, it was. We had been thinking for a while about it, and we decided we would start trying in the new year, and first time lucky, which was great. So I was very lucky. So we were told it could take a long time with me being diabetic, but I think I was very fit and super healthy as well, so I think that really helped.
Well, when the mum's blood sugar's high, that blood sugar is transferred to the baby, and kind of halfway through the pregnancy, the baby starts producing a fair bit of insulin itself because the pancreas starts working. So when the baby starts producing insulin, because the baby's blood sugar is high, it puts on muscle and it puts on fat. So the babies are, in general, probably about 1 pound heavier in patients with diabetes. Very high blood sugars are problematical because if the mum has got a major upset in her metabolism and develops diabetic ketoacidosis, that is handled very badly by the baby, and that's really a very important risk factor. So if MD is unwell during the pregnancy, they should really turn up to their diabetologist or obstetrician pretty quickly and make sure they're not in ketoacidosis. And a number of patients are doing ketone testing during pregnancy to make sure that doesn't happen. Big babies are slightly less mature, so there are more problems after delivery with things like hypoglycemia and jaundice and some breathing difficulties. Interestingly, one of the things that does worry a lot of mums is that what happens when I'm hypoglycemic, or when the mum's blood sugar is very low, and the baby's blood sugar is low too, but it doesn't seem to cause any problems. So low blood sugars don't cause any problems for the fetus.
What advice would you give to other girls with diabetes thinking of becoming pregnant?
I would definitely say it's very important to test all the way through. I'm taking 7 blood sugars a day just to get the control right. So that would be my main piece of advice as well. If you're going out driving, to test before you go out driving, because you can become unaware of hypos, or if you feel generally unwell, test then as well.
Any woman planning on getting pregnant is get your HbA1c around the 40s if you can, because it'll cause you a lot less stress, and it's just a good thing to be doing anyway. So do that, and once it's down there, it's easier to maintain around that level as well. So there's less chance of any complications during the pregnancy and when the baby's born.
The most important thing we do in MD thinking about getting pregnant is getting along to a clinic where we can discuss their fitness to start a pregnancy. And we're really aiming to get their glycemic control, their diabetic control, as tight as it can be without the patient going hypoglycemic. Now, for example, that might be an HbA1c of about 53 or under. In old money, that's about 7%, and some people would like to get it even tighter than that, but that's practically quite difficult to do. So we want to make sure your diabetic control is as good as it can be. We want to make sure that we have looked into your eyes and that your kidney function is nice and stable. We want to make sure you're not taking any nasty drugs, which patients sometimes take, like ACE inhibitors or statins, which are more commonly used in diabetic patients but are contraindicated when you become pregnant. And we want to make sure your nutrition is good, so that if you're a bit overweight, we'd like you to lose some weight. And we want to make sure that you've got a nice balanced diet before you start on the pregnancy, and then you're fit and doing bits of exercise.
Okay, so Buggy Fit is a national company and it specialises in pre and postnatal fitness for new mums, where they can bring their babies along to the class, and we do all the routine outside in the parks throughout all different areas UK-wide. And the great thing about it is that it brings mums together, and not only do they get their pre-baby fitness back, but they also meet new friends as well. So there's a big social aspect to it too. Okay, well the mental well-being aspect of any exercise is that it releases endorphins. That's the sort of physiological part of it. But just the side of feeling better about yourself and knowing that you're getting out and you're doing something positive for your health and your well-being as well. So the fitness side of things will help to, alleviate certainly symptoms of diabetes, and also any types of depression that might be related to that, or maybe just having a baby as well.
My pregnancy was quite good actually. The first 2 trimesters went really well. But in the 3rd trimester, the blood sugar sort of started to get a little bit erratic, a little bit high as well, and I started taking quite a lot of insulin. So that's kind of how they kind of went, and they were just monitoring me. I actually even ended up going into hospital once because they thought, why aren't the blood sugars coming down? Just to make sure, the hormones and the baby was okay. But yeah, we were okay, weren't we?
After the baby was born, how did the sugars go?
The sugars were quite erratic again, changing. They started to go low, so I was having quite a few hypos. And then, because I was also breastfeeding at the time as well, and they'd kind of stay in the sort of low range, so I would try to sort of have little snacks in between, even reduce my insulin, but because I was waking up during the night more than once to feed Arush, it was, taking its toll on my body. But as I sort of stopped breastfeeding her, they kind of creeped up a little bit on the high side. But at the moment, we're just trying to control them at a normal level.
Did your insulin dose change, and has it returned back to normal?
My blood sugars have dropped down after I had the baby. They dropped down to quite a bit, and I wasn't needing as much insulin straight after the birth as I was when I was pregnant.
And what about mornings? They seem to be a bit of a problem at the moment.
Yeah, the mornings are, because sometimes I get up early with Isla to feed her, my body thinks that's me up, and my blood sugars start increasing in the morning. My blood sugars have always done that, but it's more regular when you're up at 6 a.m. every morning.
Once again, the basics like keeping a good diet, cutting out alcohol and cigarettes, and receiving regular diabetes checkups are very important.